Let's see about dialysis in this video. A kidney plays an important role of filtering the unwanted substance present in our blood and excrete it in the form of urine. In some people, the kidney malfunctions and stops its purification process or results to chronic kidney disease stage 5. Or in some people, its function reduces to 80 to 95% and we call it as kidney failure. So these people need kidney transplantation. But this process cannot be done in a short time. Till the kidney transplantation is done, the unwanted substance in our body must be removed. So this process that is used for removal of unwanted substance from our body is known as dialysis. This dialysis is divided into two types, hemodialysis and peritoneal dialysis. First, we will see about hemodialysis. This dialysis is done by two methods, arteriovenous fistula and arteriovenous graft. So what is AV fistula? It is a connection that is made between the artery and the vein for the dialysis axis. It is a surgical procedure that is done in operation theatre. It is a process of stitching two vessels, the radial artery and the cephalic vein, to create AV fistula. This procedure takes a few hours and is generally outpatient procedure which can be done under general anesthesia or through numbing of arm. So how it is used in dialysis, or how the patient is connected to a dialysis machine. A nurse starts the dialysis treatment for the patient by inserting two needles in the AV fistula. One needle, which is connected to the artery, removes the blood and sends it to the machine, where the filtering of blood is done. The second needle, that is connected to the vein, returns the filtered blood flow back. Let's see about how the dialysis machine works. So this is the model of dialysis machine. It has two solutions, can A and can B, which is known as the dialysate. The can A contains sodium, potassium, calcium, magnesium and chlorine, which is also known as the acid. And the can B contains only bicarbonate, which is alkaline in nature. And together, both the solution is known as dialysate solution. So, the dialysate solution and the patient's blood moves to a part known as the dialyzer. So, this part plays a major role in the filtration process. It is the most important part of the dialysis. The patient's blood and the dialysate solution moves in the opposite direction and meets in a common place. The dialyzer has small straw-like construction which is very minute, so this doesn't filter large cells like RBC, WBC and proteins. But it filters minerals like ammonia, urea, electrolytes because they are very small in size. So what are the dialysis pipes made of? It is made of polycarbonate, polypropylene and polystrings. So this dialysis machine works under the principle of diffusion and ultrafiltration. So as we saw before, the dialysate solution and the blood meets in the dialyzer, and this process is known as counter current flow, and the solution is known as concentration gradient. So this meeting increases its rate and the filtered blood easily gets filtered through the semi-permeable membrane. So now let's see about the other method of hemodialysis, AV graft. This is the type of access used for the people who cannot do AV fistula. The graft is usually placed in the arm, but it may be also placed in the leg if necessary. AV graft is a connection of vein and artery that utilize the hollow synthetic tube. The AV graft is usually made of synthetic material of polytetrafluoroethylene. The graft is inserted when the patient's native vascular does not permit a fistula. One end of the tube is connected to the artery and the other end of the tube is connected to a vein. The graft produces solution for small or weak veins. AV graft can be used as soon as 2 to 4 weeks after the replacement. The local anesthesia is administered to the area selected for the graft placement. This AV graft surgery is generally for people who need long-term dialysis and have small or unhealthy blood vessels.